What we will do is just to keep it very simple. We will take 1 minute or 2 minutes of individually, whatever you want to communicate with reference to the topic, then we'll get into the question session. Is that fine?
Good afternoon, everybody. My name is Dr. Nilesh Bhandari. I have practiced for 10 years. In the last 10 years now, I have been into social and mobile health. So I run a healthcare social media agency and I am a co-founder of a mobile health company. I'll tell you more later.
Okay, I have a little extra to say. So, my name is Dr. Ruchi Das. I'm a physician by profession, lost that to public health a long time back. Am I audible at the back? Yes. Moved to health informatics, then started a consulting group, which I ran for 10 years, which had its niche in mobile health and telemedicine. Worked across 19 countries, over 250 projects, and recently got involved in a company called Enlightix, which is Enlightenment Through Analytics, that deals in advanced clinical analytics related to healthcare. So, so that's short and sweet about it.
Hi, I'm Saurabh Arora. Most recently, I was working in Facebook, helping connect small, medium businesses with their consumers on Facebook using ads. And one day I decided to, why don't we use the same skill set to connect patients and doctors? So I started a company called Library, which is a mobile healthcare communication app that one can use to talk to doctors.
Hi, this is Anil. I'm founder CEO of SmartRx. We provide care management, post-discharge care, chronic care, and also telehealth. We probably have the best mobile telehealth platform right now in the Indian market.
Hi everyone, good afternoon. This is Govind. I look after mobility products in Vodafone. So health for us is about transforming lives, and we always, what keeps me ticking in the morning is about how can we innovate using new technologies to improve healthcare in the market. So looking forward to an engaging discussion.
Hi, my name is Dr. Nilesh Shah. I am a group president of Metropolis Healthcare Limited. I have been with the company for 28 years now. And as a lab, we have about 125 different labs across the world. India, outside India, a lot of locations, and we have about 800 centers. For a pathology laboratory, technology and remote access is extremely important. We are quite tightly linked to services, and today, whether you say pre-analytical, analytical or post-analytical, any of the area, if you want to be successful in terms of quality, turnaround time, efficiency, all those things, IT plays a very vital role, whether you say just a mobile app or IT solution itself. So it will be very interesting to discuss with you all. Thank you.
See, if all the startup or innovative solution providers are in front of you, and as a providers like hospitals, they approach you to choose the right product. How would you help them? What do you think as a hospital? Because see, I really don't want to get a kind of marketing or technology related presentation, but people to understand from the hospital background. During lunch session also, I was trying to understand the problem. Most of them say we don't know how to choose the right product, we don't know how to choose the right technology, etc. And all these products are really, kind of very innovative. It's really nice to, I keep getting the mailers from all of them. The moment you feel like, immediately want to get it implemented in a hospital, especially as a CIO, I really want to launch all these products straight away. But from a consulting background or from your, other experience, can you tell me, like, how do the providers industry should respond to this health?
Sure, thanks for the question. Typically in health, when I was associated with that, the way we used to approach such problems were twofold. On one hand, first of all, we have to understand the business enough to know where are the precursors of inorganic growth, or where we can diversify and engage into parallel devices or referral networks to create more business. The second thing we need to know is know more about our patients. The problem today in the healthcare industry is that we don't know much about both of these. And hence, digitization of data is very essential. Now, the good part is that at least the larger chains, like say a Metropolis or say a Fortis or an Apollo, there is some amount of digital data which is already available. But it's not been referred every time a patient walks into the hospital and not been analyzed at all. Hence, you don't know much about your business and you don't know much about your patient as to So, quickly telling about what mobile health actually is. The invention or the birth of mobile health happened when public health exercises were happening door to door. And they realized that touching billions of people in one go is almost impossible. So why not harness some of the most ubiquitous and pervasive technologies and create on them some models? And hence, mobile health, because mobile devices are the most pervasive devices. You might not have a television or something, you still have a mobile phone. So that emerged, and there came models that then used wireless networks to provide anytime, anywhere connectivity. For a provider, it is important to understand what he wants to use a mobile health device or a solution for. If it is outreach, you can partner with a development organization, provide your facilities and the spare capacity of your hospital doctors to far-flung areas and then consult them. That might not be cost effective for you, but to give you quick calculation, a typical hospital, a 100-bed hospital in India takes around 4.5 to 5 years to break even. A telemedicine center or a spoke breaks even in 1 year with 25% margins. It depends upon you whether that is the right kind of business that you want to get into or not. The second thing for which providers do adopt mobile health solution is to drive referrals to their hospitals. So there are a lot of hospitals that have cardiology as a specialty who have provided these heart monitors and stuff to dispensaries and local primary healthcare centers so that they can gain these vitals and information from remotely and then drive those patients for further analysis into the hospital. So that's the second mode. The third mode is within the hospital. If you have to connect bits and pieces so that it looks like a seamless exercise available at the bedside, you do adopt these mobile health solutions. So as everything comes together, it becomes available to the doctor as well as to the consultant physician because that drives quality as well as efficiency.
Thank you, Ruchi. Sort of in Facebook, the biggest success stories because anyone can subscribe to that and everyone has something in it. Is it going to be the same story in healthcare, especially in terms of talking about teleconsultation or telehealth? Is it for all? And when you started, what was your is it like a .com, like everybody wanted to get in a mobile app and or connected health, or did you have any calculated approach for this?
It's an interesting question. Facebook is a great company, and it's a way to get connected to your family and friends. When it comes to healthcare, there has to be a specific solution which is designed for healthcare, which takes into account of the privacy and the confidentiality issues that any for us healthcare is a very personal and a private affair. So when I started, it's the basic premise that we started. It's the democratization of healthcare. We call it internally that India is one of the largest democracies in the world, but healthcare is not democratized. And why is it so? It's because of the patient-doctor ratio. So for every doctor, we have about 1,700 patients in the country. But the ratio is pretty much skewed if you go outside metros, Delhi, Bombay, Bangalore. We're fortunate enough to be living, sitting here right now in a metropolitan city where there are many doctors. But if you just go outside Delhi, outside Bombay, outside Bangalore, you'll find that the doctors itself are not present. Forget, I'm not talking about the quality of the doctor versus GP versus specialist and super specialist. I'm talking the inaccessibility of the doctor itself. So in a country like ours, where there is this lack of skilled professional pool, which is the doctor, how do we multiply his presence? How do we make sure that he is able to see a lot more patients in the given amount of time that he has already? And that's the whole premise. We started Library, is how do we democratize this whole process so that no matter where I am, even if I am sitting in Jammu or if I am in Sonipat, I still get access to a quality doctor. And if I can save 2 out of the 5 visits that are needed for a person to visit a doctor, that I think we have done our part. So, to answer to your question is, yes, healthcare has to be accessible for all in some form or the other. And that's the premise I think it is going to be going forward. That you will have to have systems and infrastructure which is in place, and infrastructure includes not just doctor, but connectivity. There has to be connectivity in rural areas as well. So a lot needs to still be done for us to be able to sort of realize the mission that we started on.
Thank you, sir. Doctor, question to you. Sometimes, maybe it's kind of creating a debate here. When I think that telehealth, telemedicine is the most talked about topic in the conferences for the last 10 years, right?
Yeah.
So,
I'm so bored of it.
Yeah.
They don't do anything.
Yeah. So my question here is like one of the point he mentioned also the moment they're talking about telehealth, the teleconsultation, one of the main justification comes up when is like the doctors are not available in the rural area or like doctor-patient ratio. My point is if the doctors are already in urban areas, anyhow they are busy, right? It's not that they have enough time. In fact, they can visit 20 patients, they get 30 appointments or 40 appointments per day, and that's how I'm talking about reality. So where do they have time to consult the rural patients or outside patients? A. B, in case if the technology is going to help and they have enough time or free time maybe on the mobile and while waiting for the traffic, these are another set of justification they give. How serious is this kind of a health service where some of their free time can be used to consult and help the patients? And the last question for you, because from the doctor's thing, is it going to be cost effective for the patient just because it's coming through remote, consultation thing? End of the day, doctors are not going to change their consultation fee just because they're going to be on the cloud or they're going to be in the video, right? End of the day, it's a time, it's money for them. When do you design the solution or coming up with the technology solutions, how do you anticipate these issues and how do you respond to them?
Yeah, thanks, Niranjan. See, my answer here could be slightly long because there are a number of questions there. First thing is, I've got a master's in health rights. So whenever I think of a business in healthcare, I look at health rights. Does it follow what I need a patient to get? What his rights are? So the top three would be availability, accessibility, and acceptability. In telemedicine, or let's say in mobile-based healthcare, it's available for everybody, accessible to everybody, and acceptable to everybody in India. Because right now we have 80% penetration of mobiles, 10% people already have smartphones, half the people will have smartphones within by 2019. So these things will be there. So patients are ready for it. Now we come to the doctors. Are they ready for it? Today we have around 9 lakh allopathic doctors registered with NCI. Take 4 or 5 lakhs more Ayurveda. So we have a big pool. Now you say that they're busy. No, I think they're not all busy. You're talking about the top 10 percentile. We are adding 50,000 doctors every year. You don't have patients for them for the first 4 or 5 years. So if I could tap a doctor with maybe at least 3 or 4 years of experience who has the time, and who's ready to give that time to patients from far off areas to give consultation, I think those doctors will be ready. Maybe a cardiologist with 25 years of experience, he won't be ready because he's already got lots of patients. I don't even want to target him. Maybe I'll have a few cardiologists who really want to go out to patients, will have that. But a major proportion of this telemedicine is going to be with GPs. It's always going to be with GPs. And now as for affordability, typically a teleconsult is around 80% cost of a face-to-face consult, and a few other percentages thrown around are 70 to 80% of problems can be solved by a telephone or a simple teleconsultation. There's hardly 10 to 20% where a doctor actually needs to see a patient. So it makes sense to have telemedicine. Now how acceptable that would be to the patient, I think it's being accepted because Liberate is growing monthly every year. By the way, Liberate is growing, I think they overtake Practo in 1.5 years. I've just seen the graphs 2 days back. They're going to overtake Practo very soon. So I think acceptability is there. Cost, yes, it's going to be lesser than a face-to-face consultation always, teleconsult. And your other question was? I think I answered.
Thank you. Smart RX. Anil, when you design the solution, like, have you really targeted any specific tier 1, tier 2, tier 3 cities, or is it like again you wanted to really was there any customized solution per se?
No, I think when you look at telemedicine, I think let me just add a few things to what Dr. Nilesh said. I think you can also look at where it's applicable, right? There is first-time consults, there is chronic care management, and there is post-discharge care. I think all of them have different characteristics. The first-time consult I think Dr. Sangeeta was here, and actually she was telling me that there's no way you could do telemedicine for a lot of those things. I think she's probably right. I mean, I think there are questions that you need to first see the patient, the body language of the patient, how much, what he's feeling makes a lot of difference in the clinician's perspective. So there is, different applicability in all of these three buckets. So first is more about can this actually, when I think in mobile health we talk about devices that are pervasive, where you can see the heart rate, listen to the heart rate. I think these are all coming. I mean, I've seen prototypes of something that you can add to a phone, like an e-stethoscope, which is going to be available in a few years for a few hundred rupees, or being built into the phone. I think some of these technologies are required for some of the real meaningful consults to happen to the first-time consults with telemedicine. The second is chronic care. I think the type of condition there is it's a lifelong. You pretty much work with a limited set of doctors. You may not switch from one doctor to another. You work with one doctor over time. And there is larger opportunities with telemedicine. Because if you look at 5 consults that I need to do with a dermatologist, 2 or 3 can happen over time. I know it's more about tweaking my medication, making it higher dosage or lower dosage, or adding something to it. A lot of that can actually happen. And the other thing that chronic care would be that you need to have a lot of engagement with the patient. The patient needs to feel comfortable. He needs to keep getting information on a regular basis so that he can go back and be reminded that okay, this is my test coming up, and here is what I need to do. So that's the opportunity. And the third bucket is a post-discharge, which is a very shorter duration, but a more intense engagement with the patient, and that's where a lot of monitoring devices that are coming into the market and all that will help with a combination of technology-enabled telemonitoring as well as home health. So that's on one side, but where it makes sense. And then if you look at the other spectrum, which is probably very applicable in India, is yes, everybody has a mobile phone, but what is their comfortness of using that phone? Many of them can only dial digits. A few of them can download an app. A lot of them have smartphones but don't know how to download an app. So there's a lot of vagaries in terms of especially the Indian market. So what we have done is we have tried to attempt a solution that applies to 2 of these things, the chronic care management and the post-discharge care, and the horizontal spectrum of somebody who has a basic phone, which means that all you can do is give a missed call, and then it is registered and the doctor has to call them back. That's pretty much all you can do, or majority of the patients can do. And then there is the most sophisticated patient on the other side who's going to wear monitors I have this Fitbit which tells me my heart rate, and then I'm doing a video consult with the doctor and my heart rate is there, and pretty soon the doctor can listen to my heartbeats as well and do as close to a real consult as possible. So I think these are the 2 spectrums, and we realized it very early on. And we have tried to build capabilities around chronic care management, post-discharge care with the entire horizontal spectrum of somebody giving a missed call to somebody being actually having those devices.
That's good. Mr. Bhatt, in New Zealand, I was part of one of the initiatives where they're talking about the mental health, especially with stress and other pain. They were saying if the problem can be identified at the primary healthcare level, the cost of treating the patient, can be much lower than the patient ends up in the tertiary kind of treatment, where it's especially government sponsored or insurance sponsored. They really want to pick up the problem at the ground level, at the primary healthcare level, or even before that. So these kind of end up for these kind of solutions, even the Tata solutions I've gone through that. A lot of applications can come, but they can only address a certain problem, and someone has to adopt it and someone has to make it really successful. But I think there is a need for a solution provider, a system integrator, or somebody like you, really to come up with a comprehensive solution for the society or at a state level or central level. How do you respond to this kind of M-Health solutions at a larger level?
Sure. I think the role that we've identified, given the experiences around the world, and specifically let me talk about 2 examples in India. One, I think, is a largely government initiative. We've got about 2.8 million ASHA and Anganwadi workers who are actually have a mandate to improve the infant mortality rate. Now, are they mobilized enough? Probably yes. Are they mobilized, being completely mobilized? The answer is no. Can they be empowered more with the smartphones? Like you mentioned, the adoption is still low, especially in the critical delivery point, care points like these. So the answer is yes. But have the funds been allocated? The answer is again no. So it's a question of is there a benefit from such mobilizations or application of mHealth in the power of these workers actually who are actually going around different parts of India? The case is very real. Unfortunately, it's either the lack of allocation of right funds which has actually inhibited some of these programs from massive rollout. But are there funds available in innovative, creative manners by tapping some of the obligation funds with other ministries and stuff? The answer is yes. So it's a matter of bringing together a few different ministries, bodies, and also some of the private players who can actually put this together. So our effort so far has been to identify the ecosystem, because by ourselves we are incomplete to address a complete healthcare solution. So that is the first response. The second response is, like you mentioned, the patient engagement in some of these chronic conditions. And if I can take diabetes, because from a marketer standpoint, 65 million, which is a huge number, we've got diabetes patient population in India. The answer again comes from some of these innovative providers who have come in the value chain. For example, a company like DiabetaCare, who actually turns this into a service. Because you're not talking about, if I can take an example, like glucometer, which is existing in the retail market, but not connected. Now the power of connectivity and giving an mHealth solution comes from the fact that continuous monitoring of the diabetes levels, be it low or high, is more crucial for critical patients than just providing a diabetes device and do it yourself and you don't know what happens, what you have to do when the levels are low or high. So it's about tying that piece together into a service and making it affordable. For example, the service is made affordable not by selling the device, which is what you end up doing in the retail market, but converting that into a service, incentivizing the patients enough to come back to the clinic so that actually you are not just doing a reactive care, but also checking the quality of the device. You're serving multiple purposes. It's about designing that particular service, in my opinion, which will come from multiple different players. And powering, and the reason why it has to be connected, I think we are a lot more confident about proving it that yes, there is a value in connecting these so far discrete health solutions. So that's been our discovery so far.
Thank you very much. So, question to you, representing such a large chain of diagnostic centers. The hospitals, there are multiple, as you said, doctors are there, timing is available, a lot of other things. So telehealth and ML makes a lot of sense. For you, in your case, most of the time, other than maybe the samples can be collected, etc., or the reports, delivering the reports on it. What are the other new things your industry is really looking at everything?
So on mobile, there are many things. Mobile is changing lab industry rapidly. I'm still worried about the adoption fully, because I just want to share my past experience where about 10 years back when we started first time giving reports over email, and the way I had to convince people, the effort it took to make people adopt, instead of my going and delivering the reports to hospitals and nursing homes and labs, making them use web reports was a challenge. Today also, after so many years of effort, if I see my statistics, about 53-54% of people download the report but not all. Now I'm moving one step ahead with mobile, and we have launched mobile apps for all the 3 levels, for clinicians, for labs who are sending me samples, and also for patients. So there are 3-4 challenges. The good part which they will benefit is they don't have to keep calling Metropolis for various expectation they have or requests they have or whatever. They can do everything on mobile, whether they want to have sample picked up, whether somebody wants a home service taken, whether somebody wants a trend reports, or somebody wants supplies or stock for collection of material, everything is available on phone. Even for patient, if he wants to chat with the pathologist, he can chat online instead of calling call center and asking for pathologists and waiting for his time to be there. He can chat with pathologists online. All these facilities are available, but making them adopt this and making them aware about this is going to be a challenge. I still feel that there is only 2-3% of the population who want to use technology for healthcare. Most of the people want to have a verbal call or physical interaction for their satisfaction. Even when I see clinicians, I think patient is not satisfied unless he meets the clinician. I have tried this even when patient wants to discuss a report, what satisfaction they get when they personally meet and over the phone, it makes a big difference. I think it is quite emotionally connected.
This is what I've been saying all the time.
Yeah, thank you.
Human-faced technology.
Yeah. So when you are talking, I think there is something called as emotion which also play a bigger role. You understand how the person is reacting. When you are remote, you don't know how he is reacting. When you are talking to him, whether he is taking it nicely, he is getting upset about it, you can't make out. So I still feel in India it's a long way to go where you do everything remote. I would definitely agree that we push services to it. That I don't want lab to call up and say pick up the sample. Let him just use the app. I don't want a patient to call up, say I want to book home visit, and he keeps reading on a call center. Let him use the technology. But I think consultation, advices, all those things, I think personal interaction will be better. So my apps are actually lined on that line where I understand human psyche, at least Indian psyche, and then adopt it.
I think question will go to Saurav. From a patient perspective, like I go to Google Play or stores, any of the stores, I have hundreds of healthcare applications customized for Indian market already. Which one to choose? Okay, and again, the next thing is like especially in your I think most of your services are linked to the hospitals, because there are some service providers or some independent individual doctors. So if I'm sitting in a particular area of like Delhi or whichever area, for me even to know which product has more connectivity to my kind of doctors or etc. It's a kind of a challenge right now from the patient perspective to choose. And similarly for the doctors also, whether you are connected, what kind of population you are connected to the other end. So in the connected health, these are the two big stakeholders. Like how do you ensure that like you target the right set of population, or is it like you're just allowing it, the market drives you?
So, there is a, I'll answer it in a different way. So what happens in US, particularly in the West, businesses drive innovation. So, we can take examples of Airbnb. Nobody said that I want to share my house. We talk about Uber. People were not looking for a taxi hailing app. We talk about Facebook. People were not asking for an app that they can share their profile. So there are n number of examples in the West that businesses are the ones that drive innovation. But when it comes to India, it's the other way around. It's the consumers. We as Indians, we drive innovation. We actually tell what we want. So cash on delivery is the perfect example. None of the e-commerce companies would have thought that COD would be the majority of a payment mechanism. But that is how it is. That is how users said, hey, I'm not comfortable using my credit card, and I want this to pay by cash. So coming to the healthcare as well, we have taken a consumer approach. We have seen that what consumers want is what we would service first, because consumers are the ones who are driving innovation. So I completely agree him when he said that there has to be a pace technology, and that's the only reason we launched video consultation. It was not as part of a roadmap. When we started, we launched this communication platform in Jan of this year, and if you see the app today, it's completely different. It's completely different. It's not even the interface, the flows are the same, and we are changing every day. And we launched this video consultation only because consumers demanded. They said, I want to talk to a doctor. I want to get into face-to-face call. And they were the ones who were suggesting let's do a Skype call. Right? So they were talking to a doctor and saying, are you available on Skype after 8 p.m.? So we said, why this guy is talking to Skype? Let's build a Skype-like functionality in the app. So that's the one part of the question as to the consumers will drive innovation. When it comes to the supply side, which is the service providers, and supply side includes, there are many entities. So right now it's just the doctors that we are associated with, and we have path labs, imaging services, we have pharma companies, we have insurance companies, OEMs, and then there are consumer device companies as well. So most doctors, at least in metros, they have some sort of a smartphone. I think this penetration would be greater than 100% because they have more than one phone. One for their patients and one for their personal family and friends. So we have found that the supply side also is mobile phone. In terms of your the second piece, which is regards to which solution should I use, I think it's not about anybody. I don't know if anybody would go online and say, even from a consumer perspective, hey, I want to talk to a doctor. Let me search an app. Right? It's primarily driven by word of mouth. It's primarily driven by what my uncle did it or what my friend suggested. It's all word of mouth in India, and there is a way to enable that word of mouth through sharing and these technologies which are available. We call it internally user-to-user referral. That's sort of a naming that we give. But that word of mouth rise. So when one guy or one person has a good experience on library, we know it because he gives feedback, and then we know that he is a good user. We prompt him to sort of tell to his friends, 3 or 4. And that's how it spreads. Right.
I think on behalf of all of you, I think I asked most of the questions. So assuming that those questions are answered, running short of time, so we'll wrap this session. Thank you all the panelists.